Today I'm sitting here with Dr. Clare discussing all things menopause. Our conversation is purely for educational purposes and it does not constitute as medical advice. Dr. Clare, thank you so much for joining me on the couch today, having a conversation about menopause. I'm so excited to have you here.
I'm so excited to be here. Thank you ever so much for inviting me. I'm really looking forward to this discussion.
Oh, my pleasure. So today, why I'm really excited as well is to have someone like yourself who is all about women's hormones and empowering and educating women on menopause, a subject that I think now we're becoming a lot more aware about the changes that our bodies are going through, and we're getting a lot more educated. I think it's not only important that today this isn't just for our female listeners or followers, but it's mainly, it's for women, but it also is for men as well. So tell me a bit about Dr. Clare, your journey, what made you passionate about wanting to specialise in women's hormones and health, and where you come from.
Oh, okay. So I would say it's from my own journey. Honestly, I just bought into a new medical practice at the time. I realised or was told that I was going through perimenopause, and actually it was an older friend of mine who's a nurse who said, "You do realise this is perimenopause, don't you?" And I was like, "No." I was really offended initially. I was like, I'm too young. Classic, eh? Yeah. I was 44. And I thought, no, I'm too young. So that then led me in search of trying to find help for myself, and realised there was not a lot of help there. And also it was a huge light bulb moment where I'd had patients at that point who'd been with me for several years, and there was this band of women, mostly in their mid-40s, who were getting palpitations, having these new marital problems, just things weren't right. They were saying, "Look, I'm not right." Every test was coming back entirely normal. There was nothing that I could find. And then it was a ping, oh my goodness, these women are in perimenopause. Because no one ever comes in and says, "Oh my goodness, my periods have stopped and I've got hot flushes." If they did, a trained monkey could do that. That's not what happens here. This is the subtleties of perimenopause. So I was like, right, what do I do? So I called around a few. So in the UK, when you are looking to upskill, you'll call colleagues who do, what you're looking to do, and you say, "Hey, can I come and sit in with you?" And in the NHS, they're like, "Absolutely, you can, because I'm drowned in and I need you to help." So I called around in Australia, and I was just getting told, "Oh no, we don't let doctors sit in." I was like, "Oh no, what am I going to do?" So I got on to King Eddie's, and there's a fantastic doctor there. Well, they're all fantastic, but there was one in particular who I just kept asking, and she really wanted to help me. And it took a lot of paperwork, and I think it was about the best part of 2 years really before I could get in to sit in and upskill. So I went in and sat in at a few sessions there, and then I did, Dr. Louise Newton in the UK does a confidence in menopause course. I did that as well. And went off to breast clinic, and then I combined what I learned at breast clinic and what I learned at King Eddie's and the stuff from the confidence in menopause, and it just snowballed from there to the point where I'm actually going down to Esperance now, because there's so many ladies from Esperance coming up to see me in Perth that I'm going to actually go down there and see them. But it's been a huge journey, but it's the best medicine I've ever done. There's nothing better than watching a woman who is having a terrible time come back 3 months later and is like, "Oh my God, I've got my life back." And
that would feel so rewarding.
It is so rewarding. There's no, I've done all sorts, from being an army medic to, all sorts. But
so how do you go from being an army medic to now to specialising in women's hormones?
I don't know. So I was a combat medic in the British Army for 6 years, and I left to study medicine. So I could have stayed in, but I felt I'd done my time. So I left.
I'm glad that you've come into
and then come over to Australia.
Yeah. So let's go back to basics. Explain to me perimenopause, menopause, and postmenopause.
So perimenopause is the time where your hormones start changing. It's termed at the time of hormonal chaos. This is where you don't know if you're coming, going, been or went often. And this can actually start happening up to 10 years before your period stop, 10 years.
Wow.
So if you go into menopause on the earlier side, which is still perfectly normal at 45, take 10 years off that, that can be from 35 onwards, you start having hormonal changes. Now that doesn't have to be changes in your periods at that point. Quite often there's very subtle changes or no changes. And technically, you're not in perimenopause because the definition is more than 7-day period changes, but we know things are happening at that point.
Well, yeah, especially the bit where you're saying about your period. Like, I'm on the marina, so I wasn't even getting my periods and the symptoms. So, you know, some of my friends will go, oh, but my doctor said I'm okay because my periods are still fine. And I'm thinking, well, you just said 10 years prior to your periods changing, you know, that's a lot of time there.
Absolutely.
And so for me, not having that, I mean, the symptom for me was that more the dark cloud sort of hanging over me. So I lost that sort of sense of joy.
Yeah.
And that was probably the start of it. So I just find that really interesting that you hear, I'll be honest, it's probably the most common thing I hear is that I still have my period, so I'm not going through it.
And it's completely incorrect. Just because you're having your period, you can absolutely be in perimenopause and you don't need to suffer. Ultimately, you do not need to suffer. So it's about finding someone who is savvy with hormones and willing to listen, most importantly, and then you'll be able to get the help that you need. But you do not have to wait until your periods stop.
So explain to me then menopause.
So menopause is when you haven't had a period for 12 months. So as you alluded earlier, people with the marina, people who've had a hysterectomy may never know the day of their menopause. Really interesting fact, over a 3-day period, you go from being perimenopause to menopause to postmenopause over 3 days. Is that not mind-blowing? You know,
really? So you're saying I could be in perimenopause and then in 3 days I could be in menopause?
No. So you'll be in perimenopause and then when it gets to 12 months since the last period, that day is your menopause and the very next day is postmenopause. So over a 3-day period, every single woman will go from peri to meno to post.
Wow.
Isn't that mind-blowing?
Yeah. So then, okay, so we're talking about menopause, then how do you know when you're getting into post?
It's just the very next day.
No, I thought I was misunderstanding what you're saying. So you're saying that when you're in menopause, you can literally 3 days later, you go into post.
Menopause is 1 day of your life. 1 day. 12 months since your last period, that is it. Obviously, the difficulties come into it if you've had a hysterectomy or a marina, because it's, you know, you can't see what's going on with the hormones at that point. But when you haven't had, if you were having a normal cycle, then you went into perimenopause and then your periods were changing. When you get to 12 months of no periods, that is your menopause day. The very next day you're in postmenopause and you will stay there till the day you die. So you go
I'm so surprised.
Menopause, postmenopause over a 3-day period. Every woman will do that.
So over a year ago, I came to see you and so I'd say basically it's been, you know, maybe 15 months I've been on estrogen. So I've come to see you, I was going through perimenopause. You're saying to me now that ultimately I could have already gone through menopause and be in post-menopause, right? Yeah. So if I'm understanding that correctly. So for me, I came to you with the symptoms. I was feeling, you know, thoughts of, you know, just feeling really flat and that unlovable. It was funny, on that questionnaire where I asked that question, it said something, if I remember correctly, you feel unlovable, is that right?
Unloved feelings.
Unloved feelings, yes. So, and I was like, yes, I felt that. Yes, I felt, you know, like that dark cloud was hanging over me. I had some night sweats, but I was obviously not knowing whether I was on my cycle or not because I was on the marina. But then soon as I took the estrogen, and this is my own experience, I, in 3 days, felt a difference. In 3 days, I felt like that dark cloud had gone away. Mentally, I noticed the change straight away. And I was like, oh my God, I'm feeling amazing. It was like I was back to myself again. Yeah. And now, a year later, I say I feel that I'm at my prime in my life. I feel the strongest I've felt. I feel super healthy. And obviously, it's not just estrogen that I'm taking. Yeah. I also look at my diet and nutrition around that and my training around that, which everybody's starting to learn. You know, you have to change as your body changes, your diet, nutrition and your workouts. So anyway, after taking the estrogen for a year, honestly, I feel so good. And I think, oh my gosh, is this feeling going to go? Like, are my symptoms going to get worse? And then I know I'm going through postmenopause, or am I not going to feel any symptoms because I'm on the estrogen?
First of all, that is something that I hear so often from my ladies when they've come in and they're feeling terrible. They think there's absolutely no way this is going to work. They start the HRT and they come back and they feel so much better. So it's really, really common. And another thing is, as you say, you know, it's not a magic wand. It's not it's not in isolation. To feel better, you need to add in the exercise. You need to do the nutrition. You need to do the work on yourself. But if you join all those bits together, it makes a huge impact, and not just for now, for your future health, and that's what we need to be looking at. But yes, you know, it depends on where you are. So say, for instance, you've still got your own estrogen in the background, which I suspect you will. I suspect you're probably in peri. As that peters off more, we may well need to adjust your hormones. So you may find down the line that some of your symptoms return, and then we'll just optimize and adjust your HRT regime as we need to.
Oh, great. And then, so is there an end date? Like, do I ever stop taking estrogen? If I'm 80, am I still taking estrogen? How does it work?
Do you still want to feel good at 80?
Yeah, I want to feel like I feel now.
Look, every year we check benefits still outweigh risks. If benefits still outweigh risks, there's absolutely no reason to stop your HRT, ever. What you said there, so you've said already that you have the Mirena, and you said you take progesterone. And that's a really interesting thing.
Yes.
Because women who've got the Mirena, if you've got the Mirena in place, that is giving you progestin to the uterus. So that is protecting your uterus from endometrial hyperplasia, endometrial thickening. Because if you take estrogen on its own, you can get a thickened endometrium, which can turn to cell changes, which can turn to cancer. So we need to give progesterone to those ladies. But if you've got a Mirena and it's less than 5 years, 4 years in some instances, you don't need to then add back progesterone, as in the micronized progesterone that you're taking. But as you said, so many women need it because the Mirena or the IUD is doing absolutely nothing systemically. So it is acting locally.
It's looking after here,
there, but it's not doing
here.
Exactly.
And that's why. So in the beginning, you said, well, we don't need to, we'll see how you start going. And it was like 6 months later, I came to you and I'm like, Claire, I'm starting to get really snappy and emotional, and the anxiety, it was just what came over me. And it must be that time of month because I wouldn't know because I don't get my cycle. And then you're saying, well, just because you've got the Mirena doesn't mean that. So you explained that to me, and I thought, not everybody knows that. And it's so true because it makes such a difference taking it.
Yeah, absolutely.
Now, I only take it, I think, for a week, twice a night, and I feel like that's enough for me. And is that right that I'm taking it to suit my body? Because some women are taking it all throughout.
Absolutely, you know, and what you're doing is you're using it just in that week that you are probably leading up to your period.
Yeah.
So when your progesterone is dropping, you're just topping it back up. That's absolutely fine.
Oh, that's great. So we've gone peri-menopause, now a little bit more on post-menopause.
Post-menopause. So at this point, you know, your ovaries have given up, and it's not just the ovaries that produce the estrogen, progesterone and testosterone, but the ovaries at this point have pretty much packed up. Yes, you might get a small amount of estrogen, but mostly it's depleted. So if you're having your estrogen added back, that's going to really help with your cardiovascular health. It's going to help with your general health overall, but it's not coming back. So post-menopause, you are in post-menopause forever. And so often I hear women say, oh, you know, but I'm through the menopause. You're never through the menopause. Yes, you might be through your menopause day because it's literally one day on the calendar and then into post-menopause, but you're never getting out of post-menopause. It is a hormone deficiency that is not going to adjust itself unless you take the hormones.
Wow, honestly, I'm still surprised about that. You're in menopause one day.
Yeah, one day.
You know, one day.
And we talk about menopause.
I know.
We should be talking about
perimenopause
or post-menopause.
And so what I really want to talk about as well is because I'm so pro, you know, HRT from my own experience and feeling amazing, and ensuring that women really need to educate themselves. What about the stigma? Because I'm not a GP, when people go, oh, but my family's got cancer, so it's in the family, I can't take it. I don't know what to say. And I'm not going to tell people because I'm not a GP, right? So I just want to know, what is it that you do for people that have cancer in their family, breast cancer, you know, through their family?
It generally doesn't make a difference if they've got breast cancer in their family. 9 out of 10 women who get breast cancer have no family history. So does that mean we never give HRT to anyone? We all need to be vigilant. Now, don't get me wrong, there are certain genetics in family histories that we need to look at, you know, more closely. But for the majority of women, you know, if you've got an auntie, a mother who's had breast cancer, that doesn't mean that you cannot take it. We just need to make sure we are cautious with you when we've looked at everything. And that's the importance of finding a menopause doctor, someone who's really going to go into all of that. But just because you've got a family history of breast cancer, in most instances, does not mean that you cannot have HRT yourself.
And that's why I say to people, see a specialist. You specialise in this area. Going to a GP that it's, you know, is across everything and more for, you know, not specialising in that. I think it's just so important to be monitored. It's not just a once-off visit to you.
No.
It is, honestly, you need to track your hormones because everybody is different, or track how you're feeling.
Yeah.
Some friends will have a certain dosage and mine will be double or less, and so everyone's dosage is different, and it really is a bit of a trial and error as well, isn't it?
Absolutely, and it's individualisation of patient care. You know, as you say, how you will respond and what you need will be very different to the person next to you. Yes, there's, you know, sort of standard regimes, but we adjust from them and we tailor to the individual, and are so important. But I think the big value of going to a hormone doctor is when you go along, it's the preventative care. It's looking, it's so when you come and see me, as you know, I'll do a breast check, I'll do an abdomen check, I'll do a pelvic check, I'll check your armpits, I'll check your clavicles, I'll make sure everything's okay, I'll make sure your blood pressure's okay, I'll make sure you've had your DEXA bone scan, make sure your bloods are up to date. And then we do that every year to make sure we're on top of everything. It's a check to see how you're going and what we can do to optimize your health into the later years, because what we do now matters for down the line. What we do now makes a huge difference on whether we're going to live with frailty down the line or whether we're going to live in good health. It really matters.
So true. And even when I go to my GP for my iron levels or checking other things, I'm like, I want to make sure I'm at the optimum level, not just scraping in, because I want to feel, you know, I want to feel that energy and feel great, and not just be like, okay, I'm at the bare minimum. That's okay. You don't need to do anything. So I think that's really important. One thing I want to ask as well is, I often hear, I actually get people asking me when I do talk about menopause on my socials. People will message me and say, can you recommend a natural supplement? And I turn around and I say, what is unnatural about estrogen? Because I personally don't think there's anything unnatural about it. And we're putting other synthetics and other crap in our body, or drinking alcohol, yet we say it's not natural.
Exactly. I have nothing to add to that. Absolutely. You are replacing the hormones that your body has always had. You know, another way that I quite often put it is, if you go to the doctor and the doctor tells you you're iron deficient, what's the first thing you'll say? You generally say, oh, what iron supplement should I take? Or should I have an infusion? You're looking to replace it because it's a deficiency. Why are we looking at hormones any different?
Yeah, it's so true. Yeah. So it really was something that someone said, and I thought, no, I have to talk about that, you know, absolutely. Because it's true.
And the thing is, we're a very different place to where we were with the Women's Health Initiative study that caused all the hoo-ha in the first place. We're using, in most instances, or I am, micronized progesterone, so body-identical progesterone and body-identical estrogen, rather than synthetic progestins. You know, that's not what we're using these days.
What about, you know, I think what's really important is people understanding what are the repercussions of not taking HRT?
Well, so again, individual, it varies person to person. But ultimately, we know that when our estrogen walks out the door, our inflammation rises. Your bad cholesterols tend to go up, your good cholesterol tends to go down. Your cardiovascular disease increases. You're laying down plaques more. When you're laying down plaques more, your, as I say, your cardiovascular risk goes up, but also your dementia risk goes up. Your bones start to thin. You start to get thinning of the vulval and vaginal tissue. Your brain, there's an atrophy of the brain. The list goes on and on and on. So ultimately, by not taking hormones, your increased risk of cardiovascular disease, dementia, strokes, bone loss, the list goes on. And what about as well? quality of life.
Yeah. It's
You know,
not
'cause I
like it
think
just
that's
that hits you.
something-
It's
yeah.
more about
Yeah.
you actually, your quality of life is declining slowly. And that's where I think that awareness there about the repercussions of not doing anything. My poor sister, she's 11 years older than me, so she's 56. And she went to her doctor and said, I think I'm going through menopause. And they said, no, you're not. So she was dismissed. And she never went on HRT until she's come and see you 6 months ago. But she's diabetic. And then from being a diabetic, she has sleep apnea as well, which is one of the symptoms of that. But all of it, everything at once, it's all hitting her. And I'm like, this poor thing, I see her suffering. I see her health suffering because I get angry because I thought she was dismissed. And now she's 56 and she's suffered, and her quality of life was suffering from not doing anything about it.
It's really sad.
And do you talk about that in your appointments with your clients, that
Absolutely.
they have to look at other areas?
Absolutely.
Yeah.
So to come and see me, because the demand is just far outstripping, what I can supply. I do group hormone sessions initially, so very much, what we're doing now. So I will discuss what is peri, what is meno, what is postmenopause, why hormones, why are we struggling to find the information now, why aren't the doctors telling us, and that's because we basically didn't have any education on it. So I go through all of that, the generic stuff with a group, and then I individualize patient care. So then they come in, they have their checks, I make sure everything's up to date. I do a thing called I Prevent with them, looking at their breast cancer family history, or risk I should say, and see what's going on with them and what we need to do to help them.
Let's go back to the group session. What is that like? I mean, when you say group session, I think, is it an AA meeting type style thing?
And that's what everyone thinks. Hello, my name is Claire and I'm a perimenopausal woman. No, it's not. It really is not. It's honestly, they're fun. I bring out the glow-in-the-dark Christmas clitoris, hangs on your Christmas tree, to talk about, the GSM, the genital urinary syndrome of menopause, the symptoms we get with our vagina, vulva and bladder. And we just talk through all the general stuff. Honestly, most women, it's one of the most beautiful things I do. When I first did it, I thought, because a lot of women, there was a bit of pushback about doing it. And they come along, and honestly, I've got to tell you a story. So I've got a coffee shop next to me, as I'm sure you know, and I was doing the group sessions, and then they were sort of filtering through one-on-one for their appointments. And one of my ladies came in and she gave me a note and she said, look at this, and she had tears in her eyes. And a lot of the ladies had gone next door to the coffee shop and were chatting, but she was sat on her own because she had some work to do. And one of the ladies had written a little note on a napkin and just shoved it over to her and said, I can see you're on your own. If you're struggling, I'm here. Here's my number. How beautiful is that?
Nice.
It's honestly, it's just reconnecting women. I absolutely love it. And you can see women in these groups who you're initially like, I don't want to be here. And the light bulbs, you can see them ping, 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 ping.
Yeah.
When they see there's other women who are going through the same, and they are not alone.
Every time I post something about menopause on my socials, the amounts of people that like what I'm saying or comment and send me questions is huge. And that's what really prompted me to have this conversation with you. But the last post I did leading up to you coming, I said that I was excited you were coming on board and we were going to have a conversation. So if anyone had any questions, send them through. So I actually have some questions for you from my followers. Now, the first one is, what are some signs that your body might be going through perimenopause? So I know we touched on that, but let's go back on that one again.
So we'll go with the classic, which I said doesn't always have to be earlier, but period changes. Yep. Period changes, absolutely, can be one. But if you're not having period changes or you're not having periods, don't worry, still go along and chat with your hormone doctor or your GP if they're happy to discuss hormones. Well, for me, my main symptoms were insomnia. I've always been a horizontal champ. I was an army medic. I could sleep 6 months on operational tour. Wake me up for dinner and the bathroom, exercise. Other than that, I'll be sleeping. And I found that I was having not so much difficulty going to sleep, but waking up early hours of the morning and ruminating, thinking about, what you said to Auntie Joan 8 years ago. Oh no, I'm such a bad person. Those type of thoughts and things like that. So that was one I was getting. The other was this anxiety. And it was... It come from nowhere. I've never been an anxious person, but that ruminating, that real knot in your chest, that really, that foreboding, just fear, the panic, something's going to happen and you don't know what it is. There were no period changes with me initially, and actually the anxiety was coming in waves. It was coming every couple of months, so it wasn't, you couldn't even really track it. No, exactly. Yeah. So I did not join the dots at all. And actually that's when I realised what was going on, that's what led me into looking into hormones and going, oh my goodness, I know nothing. How do I educate myself? That's how it happened.
Oh really?
Because, yeah.
So from your own experience,
absolutely,
you got more.
Absolutely. So despite, doing, extra qualifications, obstetrics and gynecology, family planning, women's health, sexual health, reproductive health, GP training, very little on hormones. So then I had to go, right, okay, now what do I do? And go off and do that. But anyway, brain fog, mood swings, anxiety, night sweats, hot flashes, UTIs. We need to talk about UTIs.
Yes, I actually had my friend ring me the other day and mention that, and I was like, I'm pretty sure that's a symptom of menopause.
Yeah, absolutely can be, and especially in older ladies, you are never too old to start vaginal estrogen. Never. If you are in your 70s and you start getting recurrent UTIs or UTIs, you should be on vaginal estrogen. It's something that we really need to be starting to do. They've done a huge study over in America on the amount of lives it saves, actual lives. Vaginal estrogen saves lives from sepsis. So urine infections, sepsis. Sepsis is still, I think, the #1 killer worldwide. And then urine infections, or urine infections because of...
Okay, we need to talk about this a bit more. But just a quick, so going back, you're saying if you're getting constant UTIs, that is a key sign. And then vaginal estrogen. So therefore, you're not using the patch or the estrogen.
No, you can use both.
Oh,
you can use both. It's I'm not going to quote numbers because I can't remember them off the top of my head. But there is a lot of women who need systemic, i.e. They're topical or they're oral HRT and vaginal. Just because you have topical or oral HRT does not mean you cannot have vaginal. A lot of women will need both. So if you are getting painful intercourse, if you are getting UTIs, if you're getting dryness, if you're, any sort of vulval, vaginal, bladder problems, look at the vaginal estrogen. And it's not just vaginal estrogen. There's pessaries, which are vaginal estrogen. There's topical vaginal estrogen. There's also DHEA, which converts to estrogen and progesterone. There's so many different options.
Wow. See, it's just things people don't talk about.
No, exactly.
Really, they don't. You don't sit there going for lunch with your friends going, I've got a really dry vagina.
You need to get some new friends.
Okay, so next question. That's a good one. One myth about HRT you want to bust. There's probably a few, right? But what do you think, out of all your clients that come to you, what's the one myth that has stood out?
When I have chats like when I was talking to your husbands about menopause at I think the college ball.
College ball, yeah.
I need to get a life. I think it's more the amount of women who say, oh, I don't need to do that because I'm through menopause.
Well, I've actually heard that comment myself. I'm in postmenopause. I don't need HRT.
No, I'm through that. Yeah, or it didn't affect me. Yeah, I didn't have any symptoms. Your bones are still thinning. Your risks are still increasing. So, and you're not getting out of this. No one is getting out of this alive.
You're declining in postmenopause. Yeah. You're thinking you don't need estrogen, but your quality of life is declining. So why would you not take it?
Well, a lot of women just attribute it to this is their lot. This is what happens. This is part of being a woman. This is part of aging, when they're wetting themselves or, they literally cannot have intercourse with their husbands anymore. A, because, they don't want to because the mood is completely gone because they have low libido, but also because they've got, vulvovaginal atrophy and actually sex is so painful. They would rather chew their own arm off than have sex because it's that painful.
That bad.
You can literally get the entrance of the vagina almost closing where it gets so thinned and narrowed, stenosed. Yeah,
I can't believe how much the woman's body suffers and that you think there isn't a solution.
No, exactly, and there is. And there is. And it's a very, very simple one.
Okay, so now the next one would be 3 basics you want every 35-year-old or plus to prioritise now.
Making sure you know what your bone density is doing. That is so important.
So how do you check that?
You go and see your GP or you go and see a hormone doctor or an endocrinologist. I've got discount cards that I got from one of the local radiology departments just to reduce the cost, because you don't get one on Medicare until you're, mostly about 65. There's variations, but the majority of people don't start getting them until, the horse has bolted. It has gone. It's not in the field. It's actually in the glue factory. It's gone. You know, it's not around. We need to know now, because there's no point finding out when you've got it. That's too late.
It's too late with bone density.
50% of menopausal women will have low bone density and potentially osteoporosis. If you fall, you've got a 30% chance of death in the next 12 months. And if you've got a fracture, 30% chance of death. We're not, you know, why are we leaving it so late? We need to know early on if you're starting to get thin in bones, so you can treat it and manage it now.
So it doesn't, 35 onwards?
35 onwards.
Be across your symptoms, monitor your body, the changes you're going through, mentally, physically, and the bone density scan.
Absolutely. Nutrition, exercise. The things you're looking into, really.
Yeah, and that's it, because I do feel it all plays a part. Your mindset, your mental health, you know, it all plays a part, what you're eating and how you're moving your body.
You know, and I wouldn't say, you know, you need to at 35 jump out and get a bone density, but I think, you know, you need to be, you know, when you are starting to think that things are on the shift, that is the time to be looking into these things. And
is it good you could monitor it, right? You start early on and then you go, okay, in another year I'll check how I'm going, whether it's declining or not, any changes.
It depends on your numbers as well, but estrogen is a treatment for low bone density as well. And don't get me wrong, you need your vitamin D and your calcium and your exercise, but you know, there's treatment options out there, but it's far better to know what's going on and try and prevent the rate of bone loss than just continue to a point where you've got osteoporosis and such brittle bones that you can, you know, your grandchild gives you a hug and you break a rib.
Wow.
Because that's what we can get to.
So true. Like, you know, I'm so glad that you've talked about bone density, because it is something that you don't often hear as well. So many women out there, and this is a question someone sent me, but so many women out there get told your bloods are normal, you're fine, and you get dismissed at a GP. But if inside they know something's not right, what would be your advice to them?
I would say seek out a hormone doctor. So I would probably go onto the Australian Menopause Society. And it doesn't matter where you are in Australia. If you go onto there, you can put in your postcode and it'll tell you who's got an interest in your area.
Okay.
Doesn't mean to say that you'll get the right fit for you on the first one. And you might have to have a little look around. But at least these people are saying, do you know what? I'm interested in this. You know, the same as me. This is something I'm really interested in doing. And, you know, I've got an interest, so come along and see me. I think you've got a much better chance there.
Just repeat what website they need to go onto.
Australian Menopause Society.
And then also, I think it's really important that they track their symptoms as well. And I say educate yourself, so you know what questions to ask and how to push to make sure. I think it's not just menopause. There are times where you need to find the right GP or the right doctor or specialist even. In any part, you know, to get my mother diagnosed with her illness, I had to go to a few GPs and push, no, something's not right, something's not right. So sometimes it isn't the first try, and you do have to find the right person for you.
Finding the right person is hugely important.
Key take out, see someone who specialises in hormones.
Definitely,
yes.
Definitely. And someone who will chat about it till the cows come home.
Thank you, Claire, so much for coming today. Honestly means so much to me, because you've really come and informed so many of our followers now around the subject of menopause, not only the female followers, but their partners and any male followers out there. I think that we've really covered off so much and it's been really educational. I appreciate your time. I know that your time is very precious. You've got a huge wait list, you know, of people wanting to see you. And so, yeah, a real, honestly, big thank you from me.
Oh, honestly, thank you for having me. It's been fantastic. It's such a fantastic topic. And by the way, I love your work.
Oh, thank you. I hope you enjoyed the Cooper conversation on all things menopause today. If you feel like maybe some of these things resonate with you or a friend, save this, share it with a friend, or simply DM me the word hormones and I can send you a hormone symptom tracker for you to keep on top of how you're feeling. Thank you.